I can tell by the buzz in the room that this has been a very successful day. So I don't want to get in the way of this, really. So I'm not going to talk for long. But I was asked to say a few words just before Kathy ends the conference. Really, just a bit about where I see the AP role in terms of health and social care integration. So I just wanted to just say a few words, which may well, I hope, reiterate what my colleague Lorraine talked about this morning. You can tell us if we're on message with each other. So the first thing I want to say is that if you look at the demography of our region, but in particular if you look at the demography of Norfolk, we are the oldest county in the eastern region. We have, by which I mean we have the greatest proportion of older people, and the population of people in Norfolk above the age of 75, I think I've got this right, between now and 2033 is going to grow by something like 97%. So it's huge. And the reason why I haven't been able to be here all day is because I've been locked in a room talking about money. And so if you add those two things together, population up, money down, we've got a crisis here, really. And we cannot continue to deliver health and social care the way we do it today, the way we have been doing it, can we? I think everybody in the room knows that. Everybody in the room, I guess, can think of ways that we could do it differently, ways that we could be more efficient. So, ways that we can join things up. So the first thing is we can't carry on as we are. But the second thing is we shouldn't carry on as we are, even if we didn't have that problem, because actually what people tell us is it makes sense to have things joined up for them. They're tired of doing the wiring of services themselves. They don't want to tell their story more than once. They want us to sort that out for them. Now, of course, that doesn't cut across specialist, professional, clinical advice and support. But what it does mean is that we can have a much stronger common basis on which we all work. And I think that's what integration of health and social care is. I don't think it's about taking social services employees and putting them in a health organisation and thinking, that's it, sort it. I think it's about person-centred care around people. It's about working around people and health and social care colleagues working together in a way the person receiving the care doesn't know where they're from. Why would you want to know? Why would you care? I wouldn't care. All I would care about is that I was getting the right service. So I think it is about us doing things very differently. And how do we do that, really? There are a number of things that get in the way of that. One of them is professional boundaries, professional jealousies. Another one is organisational rules. Another one is IT, the fact that our systems don't talk to each other. Another one is that social care is chargeable, people pay for it. The NHS care isn't, of course, it's free at the point of delivery. All that's very important. But we are not prepared, we can't afford to let those things get in the way anymore. We just have to work our way around them, which is what we're doing. So I think integration is about people. That's the first thing. And it's about us making that work. And the only way I think that makes it work is to get people like yourselves, colleagues like yourselves together, and to have that debate. And it's about us giving permission to do things differently. It's in a sense, it's about people asking for forgiveness and not for permission. It's about doing things. It's about actually folk who are out there in the community know what needs to be done. We, managers, people like me, have got to get out of the way and let you do it. And we've got to find ways of enabling you to do that effectively. We were very pleased to have our proposal for one of the national pioneer pilots of integration. We were very pleased to be shortlisted for our bid for West Norfolk. And there's also a piece of work, and there was also a bid put in from the Eastern County. I don't know whether we'll be successful or not in becoming a pioneer. To be honest, it doesn't matter to me. What matters to me is the work we've done, which we'll carry on doing. And the work, particularly in the west of the country, is about setting up a thing called the West Norfolk Alliance, which isn't an organisation. There isn't a place called the Westminster Alliance. Our notion is that people who work in whatever field they're working in, they work for one of the organisations that signed up to the Alliance, Mental Health Trust, Local Authority, Social Services, NCHC, the Acute Trust, QE, the voluntary sector and the private sector would say we're here for the Alliance. You'd create immediately a sense of joining up around us. We'd create some sense of virtual organisation around it. So people would see that these are people who work together. So I think it's about building it up from the bottom, giving permission to do it differently, challenging ourselves to think differently, challenging ourselves to deal with professional boundaries where they exist, thinking very differently about how we support that. And then there are a number of building blocks that we can build in. So in Norfolk and Suffolk, we've got the Dementia Alliance. I think it's something we should be really proud of. What we've done there is we've pooled our training money. So the training money that we have for training people on working with people in dementia goes to the Alliance. We've got to train people together, and we've got to have some common standards, and we've got to move towards that, and they've got to be common standards, whether it's health, social care, and dare I say the private sector. If you think about social care in Britain, social care in Britain is not delivered by local authorities. We don't do that anymore. Once upon a time we did. We don't do it now. We haven't for many years actually. It's done by the private sector. Care is delivered by the private sector. And of course the jobs that we're involved in as assistant practitioners, social workers, nurses, that's about assessing people's needs and coordinating care for people. I understand that as opposed sometimes to direct care delivery. But nevertheless, it's really important that we develop a range of skills in health and social care and in managing health and social care together that are transferable. That it doesn't matter what sector you work in, if people don't live their lives in compartments, they live their lives together. So I think I'm up for pooling our budgets. I'm up for pooling our budgets, frankly, for care. We have to do that, and I think we should get on with it. I'm up for pooling our budgets and our training, most certainly. And I'm up for us taking a very holistic and imaginative look about this and really supporting and enabling people who are doing that important work with people at the front line of service to have the right tools to work in an integrated way around the needs of individuals. I'm sorry I haven't been here for the rest of the conference because I would like to have heard the debate. But in a sense, I think that's my vision for how we might help to support this. So we're very keen to participate fully in the thinking around this. Thank you very much.